Medicare penalties are real, and they can cost you thousands of dollars if you miss them. But this isn't to scare you. This is to let you know that I'm a Medicare licensed professional here to help you so that you don't have a penalty. So today I'm going to break down everything that you need to know to avoid those penalties. Hi, I'm MedicareMisty, and I've been doing Medicare for over 20 years, and I'm here to break it down easy for you. I'm passionate about helping people because Medicare can be very challenging, and it's very easy to make mistakes. I have helped thousands of people to get the coverage they need without overpaying. Okay, so let's start with the three main penalties that could occur if you don't call me. So the first penalty is Part B penalty. Delaying it could cause you a 10% penalty each year that lasts a lifetime. Part D prescription is another way that you could get a penalty if you delay your Part D, which Part D is for prescriptions. You could get a 1% penalty each month that you choose not to take Part D. The next penalty is Part A. Part A could be a penalty if you haven't paid into the system. 10 years, 40 quarters could cause you up to $500 extra a month. So again, I know this is hard. That's what we're here for. I've helped thousands of people like you every day. That's all for those penalties. Now let's talk about your enrollment penalties. Your initial enrollment period is when you're turning 65. You have 90 days before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday to avoid a penalty. There are some exceptions that can allow you to enroll late. For instance, if you're still working and have employer coverage and your employer has more than 20 employees, you can delay your Part B. If you're paying into an HSA, a health savings account, you can delay your Part A also. And then there's the 8th month period to sign up for Part B on socialsecurity.gov. COBRA is not credible coverage. It's not an option to take COBRA if you're eligible for Medicare. You will incur a penalty. After you sign up for Medicare Part B, then you have 2 months to get your Advantage plan or your drug plan. If you wait longer than 2 months, you will be penalized, and it's a lifetime penalty. You really want to avoid that. So you want to talk to a professional like us so that we can help you pick the right plan. Here's 2 real clients that have made costly mistakes without calling me. One, for instance, Joe. Joe decided when he retired, Medicare was too hard, and he said, I'm gonna take COBRA. And he took COBRA instead of his Part B. He got a 10% penalty for 2 years because he did not come see me until age 67. So he had a 20% penalty that he'll have for the rest of his life. And then he couldn't apply for Medicare because he missed the enrollment date. He had to wait till the next year, and he had to wait till January and February. By putting off calling a professional and choosing the right plan, it cost Joe 20% lifetime penalty. That's why it's so important to not put this off. Another example is Susie. Susie was not sick. Susie did not take any medication. So Susie decided, I am not going to take Part B to see doctors, and I'm not going to pay Part D to get my prescriptions because I don't see doctors and I don't take prescriptions. Susie got sick 3 years later. Susie now has a 30% penalty because she was not sick then and said, well, I don't want to pay for something if I'm not using it. And this has now cost Susie 30% each month, a penalty that she will pay for the rest of her life. This is not meant to scare you. This is meant to educate you so that you don't make the same mistake. I know this stuff is hard. When I started 20 years ago, I was feeling the same overwhelm that you're feeling, but you don't have to do that because I have been doing this for 20 years to make it easy for you. Everybody's situation is unique, so give us a call today and find a plan that works best for you. Book a call with us today by clicking the link in the description. We can't wait to help you through this Medicare maze.